Hello, do you have a loved one who has Down syndrome? Have you always been interested in finding a way to help improve their brain function, to develop better brain function? Watch this video right now and you're going to see and hear a woman with her 3-year-old daughter who's got Down syndrome, how impressed she is at and surprised she is at how much better brain function her daughter is now experiencing and enjoying. Watch this and I'll be right back. So what have you noticed so far with her personality? What changes have you seen so far?
I mean, after the first week of taking the protocol, she was much more confident already. Her balance is a lot better, obviously with Down syndrome and low tone. It's a struggle to walk good and to jump and to run. Her balance has improved. Her anxiety has improved extremely. I can't even stress that word enough because that's how her anxiety has improved.
She was clinging to you. She was like afraid to be away from you.
She was afraid of everything, and especially being away from me. So yeah, now she runs in front of me, and I don't have to hold her all the time, and I don't have to be near her all the time.
And she's able to just go up and introduce herself to people?
Yes.
She's shaking hands?
And she doesn't feel overwhelmed being around a crowd of people anymore. She's not as tired anymore, so that has improved.
That's great. And you also told me that before, she's 3 years old, so the first time you heard is this is August 20th of 2019. You were here just about 2 or 3 months ago for the first visit, and before your first workup with me, before the first exam, before you followed her, you helped her follow the first protocol. Was she saying any words back then?
She was saying a few words spontaneously, every once in a while, but now that, yeah, I mean, especially after the first month of using the protocol, she has picked up in speech a lot. I feel like she can understand me better too. I don't have to continue to repeat everything. Like before that, I repeated, like that's a shoe, for example, like 100 times a day to point that out what that object is. Now I feel like I have to show her once and tell her once what it is, and she understands.
And so, she's got some sentences, you were telling me.
She does. She puts...
And I'm sorry to interrupt, but before it was like one word here and there, sporadic and not too frequent.
That's right.
But now...
And now she can put a 3-word sentence together spontaneously, and she does that throughout the day. And she also starts singing songs with a couple of words in there. So that's very exciting for us.
Because there were no...
There was no word, not one word if she was listening to a song. Now she's putting a couple of words in that song that she's singing.
Definitely in this first, why we're presenting this to you is because people with Down syndrome, you're part of that community and you've seen people with developmental problems.
That's right.
Right?
Mm-hmm.
And so when I first met you, I noticed what was going on with her with the anxiety and the fear and the panic that was going on in this room. And that was while she was holding on to you, clinging for life. And now, so we went to these different emotional centers in the brain, and we were able to find different infections and chemicals and get them out of there with this unique work. And you've noticed a dramatic change in the personality.
And personality and also outward appearance.
Outward appearance?
Her skin has more one complexion, it's not as marble. And her eyes, under the eyes, it's not as swollen. And for me, I'm shocked.
Yeah.
It's a very good improvement for us.
Are you part of any big Down syndrome groups out there, communities?
We just moved to Abilene, Texas, so...
I mean, online, do you follow
yes.
some groups? Yeah. Yeah. So, do you think that this can benefit other people who are living with Down syndrome?
Oh, I am sure it could. Yeah. I am sure it would. Because the improvement that we've seen in these couple of months, it's just dramatic. So, I'm sure other people would see the same.
Okay. Do you think that those people should come in?
Definitely. They should definitely come in to see Dr. Lonnie Herman. He has changed our lives already. It's just been 3 months.
Yeah, thank you. So I'll put the number up to my clinic here, and I'll put up the email address that you can contact my clinic to be able to make your appointment. And I'm going to make another video describing some of the unique exam findings and the process that we did to be able to get her so much improvement with personality and with her development and being able to speak and be able to actually carry on with some songs all day in the car. So you'll see that in another video. I'll attach to this one, and I appreciate you for sharing this with everybody.
Thank you.
And you're welcome. And we look forward to helping you too. So isn't that just incredible? Her anxiety is down to 0. She is now able to walk up to people and shake hands and wave hello, and she's no longer afraid of other people. She's been much more able to now form sentences. She could form 3-word and 5-word sentences. She can communicate with her family members now. She can sing along to music. It's just incredible. And no longer does she cling to her parents. She was, when I first met with her, she was clinging to her parents of this fear and panic, anxious, emotional situation that just kept her from being able to be free from her parents in the house or around other, family friends. She was just a very stressed young little girl. And now we see such incredible enhanced brain function and reduction in anxiety, and it's just really incredible. So I'm very pleased at this, and her parents are very pleased at this result that she's had so far. And this all was after her first protocol with me. My name is Dr. Lonnie Herman, and I've developed a program that I call Functional Neuro Recovery Therapy. And there's many different systems that I've employed into one particular strategy, one healing strategy. I went back to postgraduate study for functional neurology and neurochemistry and neuroimmunology and endocrinology and blood chemistry analysis, developmental disorders of the brain for the whole Asperger autism spectrum of developmental disorders of the human brain. I took postgraduate studies in vestibular rehabilitation. This is understanding about the balance mechanisms of the brain and the ear canals and the eyes, and without going into greater detail about that. I also took movement disorder postgraduate studies, and I'll tell you that the bottom line is through various laboratories and MRIs and x-rays, and there's too much missing in those types of evaluations. As I kept looking for answers, I discovered another system that was developed by these brilliant biophysicists in an institute in Germany, Institute of Biophysics, and also brought over to the US by a wonderful Russian scientist, a brilliant man. And I discovered this work about 6 years ago, and I've just really helped figured out a better way of doing a system here, of being able to find which tissues of the brain in the individual, without doing a brain biopsy, without doing a brain dissection of the live person. Nobody's going to do that, but we figured out a way to actually listen to the tissues of the brain and find out which infections and or chemicals are in the brain, in the amygdala of the brain, which is a fear, panic, anxiety part of the brain, in the cingulate gyrus of the brain, which is the part of the limbic system. It is the limbic system, how we feel, how we can interact with others, of the frontal lobe of the brain, of the cerebellum, of different parts of the brain that help us to that when we can listen to these different tissues I just mentioned, and we can find the infections and toxins that are in there and remove them through safe and effective remedies, we can see the brain develop better. Brain function enhancement is happening for people, and the proof is right there in what the mother said about her little girl. Now, in my neuroimmunology program that I took in postgraduate study, which was taught by one of the world's most recognized immunologists, he's a PhD in immunology for more than 40 years. And one thing that he shared with us through research papers from laboratories around the world where these scientists were doing studies on people and on rodents and animals, they'd find, when they were not funded by drug companies, that is, these laboratories were finding that different infections, viruses and bacteria and parasites and mold and fungus and other and certain chemicals can actually get into the brain and into body parts and make those body parts malfunction. So I'm going to tell you right now what her protocol was like to follow and what findings there were from her examination, her first exam and her second exam that she's currently following. Today is September 6th of 2019. And I'm going to share with you the results of the second exam in a few minutes, the results of the second exam that she's actually following her protocol right now. So hopefully when I get to see her again, we can actually do another video together and we can see even better brain and body function taking place for her. They came to me because of her type 1 diabetes, yet when I saw that she had such an incredible anxious anxiety problem and the clinging to the parents, the stress that she was under to be detached from her parents was really incredible, and not in a good way. It was a very stressful thing for her parents. They love her, they appreciate her, they're blessed with having her, yet there was no separation time. Let's get into the exam findings, and I'll tell you that when we use safe and effective remedies to get rid of these different infections that I'm going to point out here, the body, and the toxins that I'm going to point out here, the body can start to regenerate and better function, okay? So in her first examination, I found stressing her cingulate gyrus. Again, the cingulate gyrus, and I'll put up an image here of this part of the brain along with the name so you can actually see it. I like people to learn about the brain. I like people to learn about the body, because when you can become better informed, you have more power for you to be able to make better decisions. So the cingulate gyrus of the brain, which is a limbic system, emotional controlling, emotional regulating system of the brain, she had a small amount of Clostridium difficile, which is a bacteria. She had Campylobacteria, or H. pylori, affecting that part of her brain. She had Streptococcus bacteria affecting that part of the brain, Staph bacteria affecting that part of the brain. She had certain vaccine chemicals like the MMR vaccine and DPT vaccine affecting that part of her brain. She also had St. Louis encephalitis virus affecting her cingulate gyrus. How did she get that? Maybe her parent had it, maybe, and it came through in the birth canal. Maybe she was bitten by a mosquito right after she came out of her mother's body, and then, shortly after, and the mosquito gave her the St. Louis encephalitis virus. The influenza virus affecting her cingulate gyrus. The influenza A virus affecting her cingulate gyrus. I found some antibiotic chemicals and anesthetic chemicals also in there. Cefdinir, which is an antibiotic, Cefdinir, I'll put that name up here on the screen. Cephalexin, also called Keflex, antibiotic affecting her cingulate gyrus. I found that propofol general anesthetic, which is a chemical that wasn't used in her, but it was definitely used in her mother at some point, where this propofol general anesthetic had gone through the birth canal. Listen, the baby, into the baby's brain, into her brain. When a baby is connected to the mother's umbilical cord, anything that's in the mother can go right through that cord and get into the baby while that baby is developing in the mother. I'll tell you, there was a study, let me pause on the report of these findings. There was a study done in 2005 by the American Red Cross. And the study, which you can find online, just look up American Red Cross, toxic baby, I think it was called toxic baby syndrome. I don't remember the exact name right now, but I'll put it up on the screen here so you can actually go there and read about this, this research done. In 2005, across the United States, the American Red Cross chose any state, any city, any hospital. There was no one city or state that was preferred over another in this test. There was no hospital that was one over another preferred in this test. Everything was a double-blind random study. The babies had to be, they couldn't be premature. They were still connected to the cord of the mother. There was no vaccine given. They had no defect. They seemed to be healthy newborn infants. Healthy, seemingly healthy when they came out of the mother. They took biopsy tissue samples of the baby. They took samples of the umbilical cord blood, and they found 287 toxic cancer-causing chemicals in the babies at birth. 287 toxic cancer-causing chemicals in the babies at birth. They found about a third of those were neurodegenerative chemicals. That means brain degeneration chemicals. That means the brain may not be able to develop properly. Or let's say the brain is developing okay, but then later in life there's Alzheimer's, there's dementia, there's brain fog, there's Parkinson's, there's some type of neurodegenerative, neurodecline disorder that develops in the person. So anything that was in the baby, it was in the mother's umbilical cord blood. The same chemicals, plastic, DDT insecticide, food preservatives, food colorings, antibiotic chemicals, and birth control pills, and diesel fuel, and anesthetics, and mercury, and aluminum, and lead, all these in these babies' tissues and in the mother's umbilical cord blood. Again, that proves that whatever's in the mother can get into the baby, and actually it can lead to brain development disorder. And no matter how many exercises you do for the brain, no matter how many brain balancing procedures, as they're called out there in the brain development world, I believe that there is only a certain level of improvement that you might be able to achieve, and that when we can actually find these different infections and chemicals that are actually trapping the brain and not letting it develop, but we can find those and get them out safely and effectively, the brain can actually develop at a very rapid pace. So I found in her brain there was propofol general anesthetic. I found in the hypothalamus of the brain, which actually regulates the pancreas and the liver function when it comes to diabetes. I'll talk more about that in another video. The hypothalamus, I found propofol. I found vaccine chemicals, again, the MMR and DPT vaccine. I found in her white matter of her central nervous system. The white matter, I found a Borrelia burgdorferi bacteria. Let me tell you, the white matter, Borrelia burgdorferi bacteria, Ehrlichia bacteria, and parasitic flukes. Now, the white matter is the part of the brain that actually helps us, which is myelinated. It's coated with this substance that helps us to be able to transfer signals from brain to body and body to brain, and from brain, different parts of brain to other parts of brain. So when there's infection that's in that white matter of the central nervous system, in parts of the area that control speech, or control memory, or control your emotions, even that in and of itself, infection in the white matter, can actually cause breakdown in brain function or lack of development of brain. Furthermore, in the fear, panic, anxiety part of the brain, called the amygdala, let's put up another image here about the amygdala. The amygdala of the brain is the fear, panic, anxiety button of the brain. When this amygdala is stressed by different infections and or chemicals, fear, panic, anxiety, and rapid heart rate and stress can be a constant for a person. Even when they have nothing else to be stressed about, everything can be okay in life. There could be money in the bank, and there could be a loving family, and everything else is good, but the brain is always stuck in a stressed, panic, or anxious state. So when we can again, when you can pinpoint these different infections, like what I found with her, where there was staph bacteria in the amygdala, we can pinpoint these and safely remove them with cures, with remedies that can actually counteract that infection in the amygdala. The brain can actually come out of that emotional state, that anxious or fear, panic, anxiety state. So the staph infection in the amygdala, that was handled in her protocol. And furthermore, regarding her diabetes, I found that there was staph and staph bacteria and candida fungus and Roundup weed killer, glyphosate weed killer spray, and parasitic flukes in her pancreas. And furthermore, in the islets cells, the islets of Langerhans, which are the cells which regulate what you do know about probably with diabetes, regulates insulin, and there's more about the islet cells that I could talk about in another video, but the islet cell staph infection in there as well. When she came back after this protocol, and this protocol lasted her for 80 days, and I saw her again 85 days or so later, she was doing phenomenal improvement. Her mother was actually just incredibly amazed, and her father incredibly amazed at how much better she was. She was no longer anxious, she was no longer clinging. You saw the video, you watched that whole video, watch it again. The life-changing, the improvements in changing her brain has been life-changing for them. It's just incredible that she can actually function so much better than she did when I first met with her. Now in her second exam, and there's a unique way of me doing an analysis that I won't get too deep into this video here, but I'm able to use certain neurological examination steps to combine with a certain bioresonance, manual bioresonance testing, and find which parts of the brain are stressed, and then find what's in them, which infections or toxins we have to get out of them in order to these parts of the brain, in order for those parts of the brain to develop better. So I found with her in her follow-up exam in August 20th, I found in the frontal lobe of the brain, which is the speech area of the brain, at least the motor control, the Broca's area of speech is in the frontal lobe. Cognition, learning, there's so much that goes on in the personality of, in this part of the brain called the frontal lobe, about personality, about brain function, that we cannot overlook the frontal lobe in assessing if the frontal lobe is healthy or not, because the frontal lobe controls so many different functions of our daily life. So the frontal lobe, she had Borrelia burgdorferi bacteria stressing that part of the brain. She had vaccine chemicals, again, the MMR DPT vaccine chemicals. She had Epstein-Barr virus affecting that part of the brain. She had influenza A virus affecting that frontal lobe of her brain, and dimethyl mercury, a very poisonous, toxic substance, dimethyl mercury, affecting the frontal lobe of the brain. I'm going to pause right now. I want you to watch something about what mercury does in the brain, and this was proven through scientific studies in the University of Calgary in Canada. Let's watch this brief. This will take about a minute maybe, and then I'll be right back.
How mercury causes brain neuron degeneration. Mercury has long been known to be a potent neurotoxic substance, whether it is inhaled or consumed in the diet as a food contaminant. Over the past 15 years, medical research laboratories have established that dental amalgam tooth fillings are a major contributor to mercury body burden. In 1997, a team of research scientists demonstrated that mercury vapor inhalation by animals produced a molecular lesion in brain protein metabolism, which was similar to a lesion seen in 80% of Alzheimer's diseased brains. Recently completed experiments by scientists at the University of Calgary's Faculty of Medicine now reveal, with direct visual evidence from brain neuron tissue cultures, how mercury ions actually alter the cell membrane structure of developing neurons. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here. In contrast, other heavy metals added at this same concentration, such as aluminum, lead, cadmium, and manganese, did not produce this effect. Shown here is a neurite growth cone stained specifically for tubulin and actin, before and after mercury exposure. Note that the mercury has caused disintegration of tubulin microtubule structure. These new findings reveal important visual evidence as to how mercury causes neurodegeneration. More importantly, this study provides the first direct evidence that low-level mercury exposure is indeed a precipitating factor that can initiate this neurodegenerative process within the brain.
Now, isn't that just incredible? You don't probably hear about this regularly when you're looking for information about what doesn't let the brain develop, or maybe just from watching the news. Well, studies have proven that mercury actually causes brain cell degeneration, nerve tissue degeneration. That can lead to nerve pain in the body. That can lead to lack of brain development. That can lead to a number of different symptoms. So the mercury, again, in the frontal lobe of her brain, that's where speech it comes from. That's where cognition, that's where being able to understand what we need to do. Now her mother can actually tell her, hey, that's a sock, and the little girl, 3 years old, Emery, she can actually know what the sock is. She doesn't have to keep repeating it to her to try to get her to understand what it is. She gets it right away. Now, I found in another tissue in this examination called the corpus callosum. I'll put up another image here that you can watch with the corpus callosum, where it's located in the brain. I'll just help you understand something here. The corpus callosum, there's over 250 million nerve fibers, wires that are in the brain that allow different parts of the brain to communicate with one another. The corpus callosum, when it's infected, when it's toxic, it can actually cause lack of proper development of brain. It can cause personality disorders. It can cause mood disorders. It can actually cause pain syndromes in the body. Her corpus callosum, I found again the vaccine chemicals there and dimethylmercury as well in that corpus callosum tissue. And there were some other findings for her part of her brainstem that also regulates body function, which without getting too deep into that, there's a part of the brainstem called the reticular formation. I'll put up a picture here to help you understand where it's located at least. You'll see this green bar, it's like a green strip highlighting where the tissue is right here in this picture. And within that, or around that tissue, it's called the pons of the brainstem, which helps regulate bladder control, it helps regulate heart rate, it helps regulate a number of different functions of the body without getting too deep into that. I'm not here to make you a doctor. I just want to help you understand more because you deserve to know more. That way you can make better decisions on what needs to be done for you and or your family member. So she also had vaccine chemicals, residues of these stressing her pons and her reticular formation. And furthermore, for the pancreas, working with her diabetes, pancreas, she had Epstein-Barr virus, she had the smallpox virus, and she had several different bacteria affecting her pancreas. Now, I've produced this video for you because you deserve to know that what's happening for one person, which is incredible for them, and the mother is here saying it very clearly and carefully and generously. She shared that video with me, with her daughter, with you, that she is amazed at how much better her daughter is doing with my work. I'm here to tell you that there is a way to help you develop better brain function, whether it's with Down syndrome as part of the person's life, or it's not. Whether if it's Asperger's or it's attention deficit disorder or ADHD, hyperactivity attention deficit, or even autism, when we can find these different infections and toxins with this unique system and pinpoint them and safely remove them, the brain can develop, number one, and the brain can develop faster in many cases than what you can even imagine. Now, in some cases, it's going to take some time for the brain to develop because we don't know the puzzle. When I first meet with a person, I don't know how complex the puzzle of their condition is. They may have only one infection. They may have 21 infections. They could have a whole list of viruses and bacteria and parasites and fungus and mold and chemicals that have gotten into parts of the brain and body that are trapping that body and trapping that brain and not letting it develop appropriately. So there are some children who can develop and even adults who are trapped in brain fog and so on, who can develop at a much faster pace, and there are some that it's going to take a bit longer. Yet development can always happen. Relief of symptoms can always happen. We've got to be able to find, which I employ a unique system, to find these different infections and chemicals and help the brain and the body rid them. So again, watch that video again with the mother describing about her daughter. I only put up a couple of preview points in this, so I think it's really best for you to watch the whole video of her describing how much better her daughter is, how impressed they are, how surprised they are. Also, you can follow me on Facebook, like me on Facebook. You can follow me on Instagram. I put up information there on a pretty regular basis. Some other incredible life-changing experiences, positive life-changing experiences that people are enjoying now, of relief of pain and better brain function. You can subscribe to my YouTube channel, and you'll be the first to know when I put up new videos. Every time I put up a new video on YouTube, YouTube will send you an email that says Dr. Lonnie Herman's basically new video is up. You can call my clinic at 954-370-3100. That's 954-370-3100. Okay? You can call and make an appointment. If you can't call and you want to send an email, the email address is up here on the screen as well. You can contact my clinic assistant and she can help you make appointments with me in my clinic here. Now, I'll tell you that the insurance companies don't recognize my work, so this will be an investment in yourself. There is no way for me to charge your insurance company and have compensation for the work that I'm offering. So this will be out of pocket. And my assistant can discuss the fees with you when you call or you email her to contact and see how to become a patient here with me. Okay, so again, the phone number is 954-370-3100. On average, we are about a 2-month wait for new appointments, for new exams. And the consultation can be done via phone or Skype, and that can be done usually within the month of you calling. We can get that consultation appointment set, but the exam appointment is usually about a 2-month waiting list. And when you come into my clinic, there's going to be expect about a 2-hour visit, a 2-hour window in my schedule for you personally. And in the consultation investigation appointment, let me just point out that there's going to be a lot of other different information that I'm asking than what you're used to hearing or being asked by your physicians who you're going to. So be ready for some other questions that we're going to have to discuss about your history or parents' history and be able to understand a lot more of what's potentially causing this condition in you. So I know what to really look for when I do this kind of unique exam I'm offering. And so I look forward to helping you. I thank you for watching this video, and hopefully it was great help for you. And if you found this to be beneficial, please share it with someone.